So generally when we go to a dentist with the pain in a tooth, and the dentist sees the x-rays and he checks the tooth and he says we have to go for a root canal treatment. It means a root canal treatment is done inside the roots, and on the top portion of the tooth you have to go for a filling, and then you have to cover the entire tooth with a material called cap or a crown. You can go for a crown, you can go for an inlay, or you can go for an onlay. These are all ways of protecting the top of the tooth so that it doesn't break while chewing. Generally, after completing the root canal treatment, because of the cavity formation, and then after completing root canal, the tooth is going to be a little weak. So once we have put a filling on the top and then we've gone for crown, this tooth is going to be very strong. And this tooth has to survive for the next 25-30 years in the mouth without any problem. So the root canal should not fail, the filling should not fail, and the crown should not fail. Now coming to this crown, what materials are used to make these crowns? Traditionally, or if you see for the last 50-60 years, we've been doing more of metal crowns because technology was too primitive. So we were going more for metal crowns. Metal can be gold, or it can be nickel chrome or base metal alloy. Then in the 90s came the ceramic. You know, the metal has a different color, it doesn't look like a natural tooth. So then we started adding porcelain on the top. So the core would be metal and on the top would be ceramic. So this is called a metal ceramic crown. In the new millennium, we started seeing all ceramic crowns. Here, the base is not metal. The base is also ceramic. The layer on the top is also ceramic. Now, coming to all ceramic, there are different kinds of materials. One of them is your zirconia. The other one is lithium disilicate. Brand name, I can say Emax. Now, coming to zirconia, you can have a full crown which is made of zirconia. You can have a zirconia crown where it is just a coping of zirconia and there's a layer of ceramic on the top or a layer of porcelain on the top. Now, if there is a layer of porcelain on the top, it's going to be more aesthetic. So if you have to go for a crown for a front tooth, I would actually prefer a zirconia core with a layer on the top. Now, these are aesthetic crowns. If I want more aesthetics or perfect aesthetics, then I have to choose lithium disilicate. The lithium disilicate again can have a core of a material and then it can have a layer on the top. As I mentioned, lithium disilicate is the most aesthetic material that can be used for crown. Now coming to metal ceramic, zirconia and lithium disilicate. Metal ceramic, I can use it for bridges also. Bridge means when a tooth is removed, I need to connect the neighboring teeth with this. That's a fixed replacement. So there I go for a bridge. If it's a long span bridge, I can still go for metal ceramic. But if it's a long span bridge, generally we don't advise zirconia because it's a strong material but a brittle material too. For a crown, it's extremely strong, but for a bridge at the joints, there is a tendency to fracture. Lithium disilicate is a beautiful material. It's most aesthetic, but again cannot be used on the long span. So if you can go for single crown or two crowns joined or maximum a front teeth bridge, you can go for lithium disilicate. So generally, the dentist decides based on what is the strength required. If suppose the dentist wants to go for a lithium disilicate crown for a back tooth, you can still do it. If the patient is a bruxer, the patient is going to chew hard, then we have to choose a material which is very, very strong, like zirconia. There I cannot choose a material like lithium disilicate. So the choice is generally made by the dentist. Coming to the cost, metal is the cheapest unless you're going for gold. Gold is expensive. Then comes metal ceramic. Then comes zirconia. Then the lithium disilicate, which is the costliest of all.